Mark, thank you very much. It is 6:22 right now. Millions of Americans live in constant pain. It can make the simplest tasks difficult, even impossible. But there is some hope. Medicines and surgeries are being developed to help, well, to ease chronic pain. One of those being developed is right here in Tucson. A story now. A woman living a normal life now, but that was not the case just a few months ago.
It's just very fatiguing to try to get through the day when you're always in pain and always kind of gritting your teeth, grimacing.
Nancy was afraid she'd have to live in pain for the rest of her life. She had knee replacement surgery, which went well, except for a nagging chronic pain in her knee. It wasn't quite debilitating, but it crossed the line of bothersome.
Every step I took, I felt it, and especially going down steps was very painful. Any type of movement where I would bend my knee and bear weight on the knee was very painful. It felt like someone was pounding a nail into that spot.
Many doctor visits later, from Tucson to New York, even the Mayo Clinic, she was at wit's end. More surgeries, consultations, and incisions later, she was still in pain. Then a physical therapist told her to see Dr. Chris Maloney.
She didn't have pain from here to here. She really had more localized pain and discomfort right in this area.
Dr. Maloney first tested Nancy to see if she was a candidate for his surgery. Not everyone is, but she was. After just 1 hour of outpatient surgery, Nancy is finally pain-free and has been since the surgery in January.
I can go for all afternoon shopping sprees at the mall or a hike, or I can swim and kick in the water without it hurting. So it's really wonderful.
And Dr. Chris Maloney joins us this morning, who performed that surgery. Doctor, good morning.
Good morning.
I talked to Nancy, and you are Nancy's hero. She tried everything, and she finally came to you, and you solved the problem. She can now go shopping and do all this stuff. What did you do?
Well, there are certain nerves that innervate or actually supply the sensation to not only the skin around the knee, but the knee joint itself. And there are some of these nerves that can get damaged either from surgery or due to different illnesses or trauma. We can identify those nerves, and if those nerves aren't working, we can actually remove those nerves to help relieve pain.
Yeah, now, for people who are in chronic pain, it is just so debilitating. But not everyone is a candidate for your surgery. How did you determine whether or not they can go through this?
Well, first and foremost, that's why orthopedic surgeons exist. A lot of knee pain is related to mechanical problems with the knee, and orthopedic surgeons are very good at identifying and treating those problems. There is, however, a subset of those patients, or a small group of patients, that continue to have pain despite seeing an orthopedic surgeon or getting other medical or surgical treatment. Those are the patients we really think that we like to try to identify to see if we can help.
Yeah, and how do I get in touch with you? Let's say I am one of those people that suffers chronic pain. How do I get in touch with you to find out if I can become a candidate for this surgery?
Well, we usually start off by seeing these patients after they've been told that nothing can be done, either by their orthopedic surgeon or their other doctor. And a lot of these patients are being seen and treated by anesthesia pain management people. So a lot of those patients come and seek care or actually come and see us when they've been told that nothing else can be done.
Right now, Nancy is going to be able to go back shopping and swimming and all these things, which she's just happy for. It's been about 6 months. She is pain-free. If you do the surgery, does it last forever?
Correct, and some people will last forever, and some people, their pain will persist at a smaller level or it could recur. Chronic pain is a very difficult thing, and this is one of many things that we use to target it.
All right, Dr. Chris Maloney, thank you very much for joining us this morning. Really do appreciate it, and I know Nancy loves you a lot. You did a lot for her. I'm sure you've done a lot for other patients as well, and he can do a lot for you, too. If you want more information, you just head on to KOLD.com, click on this story. You'll find that information there. Dr. Maloney, thank you.
Thank you.